Bismillahirrahmanirrahim. So this is the third lecture, and this third lecture will be on the rhythm ECG analysis. For the rhythm ECG analysis, we have the 7-step method, and these are the steps, and you should read the ECG one by one, with every step should be there. So let's start discuss the step one by one. First of all, you should calculate the rate of the ECG. So for the determination of the rate, we have the three methods. Number one, we label as a 10 time method. For the 10 time method, you need the 6-second step, and when you have the 6-second step, then count the R waves in the 6 seconds. So this is the first R wave, second, third, fourth, fifth, sixth, 7, 8, and this is 9. So they are the 9 R waves. Simply multiply it with 10. So this will be the rate of this ECG, 90 beats per minute. This method is very helpful in when the heart rate is irregular. The other two methods, we need the regular rhythm, otherwise you cannot calculate the rhythms. Suppose this method we label as a 1500 method. The 1500 method, just we count the small boxes between the R wave to R wave, and 1500 will be divided by that number. So here the small boxes are 20, so rate of this ECG will be 75 beats per minute. The another way is a sequence method. This is the quicker way, and we are using in the viewrs, and this is very easy to use, easy to remember. Just memorize this sequence, the 300, 150, 100, 75, 60, and 50. So please remember this sequence of the figures. And when you have the ECG, this R wave suppose touches the board line, so this will be 0 or base. Then look at the another R wave where it falls. Suppose the R wave falls over here, then rate of ECG will be 75 beats per minute. Suppose this is R wave touches over the baseline, and this R wave, suppose this is 300, 150, 100, so it's closer to the 100, and you can say the rate of this ECG is the 100 beats per minute. Then determine the rhythm of the ECG. This is very easy. Just look at the interval between the R and R, and you can say the rhythm may be regularly irregular, or it may be regularly irregular, or it may be irregularly irregular. But we have the two methods, but usually we cannot apply these methods clinically. One method is a paper and pencil method, and another is a caliper method. Exactly you can determine the rate of the rhythm of ECG. So here look at the rhythm. Here rhythm is a regularly irregular. Then evaluate the P waves. So ask yourself, is there any P waves? Yes, they are the P waves. Do the P waves are same look? Yes, they are same look. Do the P waves occur at regular rate? Yes, they are occurring regular rate. Is there one P wave before each quartz complex? Yes, there is the one P wave before each quartz complex. So interpretation, the normal P wave with one P wave for the every quartz complex. So next is the abnormal or odd P waves. Here you may find the tall P wave or peaked P wave. The peaked P wave, when the P wave is more than 2.5 small squared, we label as a enlarged P wave. We label as also as a peel pulmonale. The causes are the atrial hypertrophy or the enlargement because of the pulmonary hypertension. What is the cause? It may occur because of the pulmonary hypertension. It may occur in the valvular heart disease or heart failure. Sometimes we see the inverted P waves. They are not usually upright, but they are the downward. So this is show the retrograde or reverse conduction from the AV node or AV junction toward the atria. You may also find the different types of the P waves, different shapes, and between the impulse may be coming from the different sides, as with the wandering pacemaker rhythm, or the irritable atrial tissue, or damage near the SA node, where you may find the varying P waves. The absent P waves is also seen in case of the atrial fibrillation, where you will didn't find in any P wave and rhythm also the irregular. So after the P wave, then determine the duration of the PR interval. This is very simple. Just count the small square between the P and the R and multiply it by the 0.04. So normal PR interval is 0.12 to 0.20 or 3 small square to the 5 small square, or you can say 1 big square. Then the abnormalities may be short PR interval or it may be prolonged PR interval. The short PR intervals means the interval is less than 3 small squares. It means the impulses originate from other than the SA node, and it may happen in the junctional arrhythmias or pre-excitation syndromes, just like the WPW syndrome. The prolonged PR intervals means the PR more than 0.20 or 1 big square, and this may occur in the digoxin toxicity. It may in the heart block, or it show the ischemia or conduction tissue diseases. So here the determination of the PR interval and interpretation is 0.12 second, and then determine the duration of the QRS complexes. Here also just count the small boxes and multiply it by the 0.04. Remember, there's no any horizontal component in this QRS complexes. Then ask yourself, is the duration is normal, or the QRS complexes are the same size and the shape? Does QRS complex appear after every P wave? The QRS complexes may be deep or wide. The deep wide QRS waves may represent the myocardial infarction. The notch or deep waves may slightly signify the bundle branch block, either the right bundle branch block or left bundle branch block. The widened QRS complex more than 0.12 second may occur in the ventricular conduction delay, or you can say premature ventricular conduction PVCs. You may also miss the QRS complexes in case of the AV block or in the ventricular standstill. So here the interpretation of the duration of the QRS complexes, and result is 0.08 second, means it is normal. Then after the QRS complex, then determine the ST segment. The ST segment shows the end of ventricular conduction or the depolarization and the beginning of the ventricular recovery or repolarization. The normal ST, this is the extent from the S wave to the beginning of the T wave, and usually this is isoelectric. So here this is the ST and this is the isoelectric. But in the chest leads, this ST may be 0.5 to 1 mm up, or it may be down. But remember, in the limb leads, this should be normal. 1 mm up or down may be considered abnormal. So the ST segment depression, here depression is usually indicate the ischemia or digoxin toxicity. The ST segment elevation, it's maybe occur in the myocardial injury. The J point, actually this is the end of viewrs complex and the beginning of the ST segment, and it is helpful to determine the length of ST segment. So here are the two segments. This is the ST and this is the TP. TP, this is very helpful to determine the level of the ST. So this is the use for the baseline in case of the ST depression or ST elevation. And then evaluate the T waves and ask yourself, are the T waves are present? Yes. Do they all have the normal shape, normal amplitude? Yes. Do they all have the same amplitude? Yes. Do the T waves have the same deflection as the viewrs complex? Yes. So why are that T is so bumpy? Here look at the T, this is normal, but here they are slightly dip over the T wave, and this is happening when the P wave merge over the T wave. So T wave peak, or you can say tall T wave, this tall T wave may occur in the acute myocardial infarction. The bumps in T wave may indicate the P wave is hidden in it. If the P wave is hidden, then atrial depolarization has occurred, the impulse having originated at a site above the ventricles. The tall peaked or tented T waves, we already discussed, this is occur in the myocardial injury or the hyperkalemia. The inverted T wave in the lead 2, 3 or V3, V6, this is occur in the myocardial ischemia. The heavily notched or pointed T wave, this may occur in the adults with the pericarditis. Then lastly, the last step is to determine the duration of the QT interval. So here also very simple, count these small boxes and multiply it with the 0.04. So normal duration is 0.36 to 0.44 second. So what is the importance of the QT? The QT is very important. The abnormality is duration may indicate the myocardial problems. The prolonged QT intervals increase the risk of the life-threatening arrhythmias and known as the Thucydides D points. The prolonged QT syndrome is a congenital conduction system defect present in the certain families, and here if any drug that prolong the QT will produce the arrhythmias. The short QT, it may be because of digoxin toxicity or hypercalcemia. So this is normal sinus rhythm, and you can write the answer with this step like the regular rhythm, normal rate, a P wave for every viewrs complex. All viewrs complexes are similar in size and shape, normal PR QT intervals and normal upright T waves. So this is the end of this lecture, and in the next lecture we will describe or discuss the arrhythmias. Thank you very much.